So let's talk about this long-term care thing as that third piece.
Probably a long-term care event, and it's simply, to be clear, like you said, it's not health care. It's not doctors and and prescriptions and hospitals. That's Medicare. That's health insurance. Okay. A long-term care event is the result of simply getting too old and infirm to take care of yourself. They're called activities of daily living.
ADLs, yes.
ADLs. There's 6 of them. You know, the transferring, bathing, dressing, eating, toileting, continence. Anybody that can't perform 2 of those would qualify for long-term care benefits under long-term care insurance. And normally the help is delivered either in the home through many of these home health care agencies. A new upcoming industry is called adult daycare.
Yes.
So because there's a lot of older adults that are now living, a lot of seniors living with their adult children, but they're still working.
Right.
But it's a place for people to receive a lot of the help when the adult children caretakers have to attend to their own lives. And then of course there's assisted living facilities, and there are then what they call full-blown skilled care, which were called nursing homes.
Right.
Getting away from that.
Yes, right. They
that
cleaned it up.
term, but that's the whole idea. Medicaid only covers skilled care. Long-term care insurance, however, pays for all of the above.
Plus, they can stay at home.
You have options.
I
Isn't
mean,
the Holy
that to
Grail
me
to age
is
in
so
what they call
wonderful.
aging in place? We've
Yes,
heard that term.
yes,
That
yes.
means I want to live in my own home for the rest of my life.
Yes.
I don't want to be shipped off to an institution. Is
Right.
The word long-term care insurance means you're always in control.
That
Once
is
you're out of
powerful.
money and you go on Medicaid, which is welfare,
It is.
you are a ward of the state
It is.
at that point, and then it's the state that makes all the decisions. They tell you where you have to go.
Now, one of the things that I hear oftentimes is I can't afford the premiums because the premiums many times are more than they feel that they can pay. What is your response to that?
It's a necessary evil. Let's face it, long-term care claims
Yes?
are very big. I'll be the first to admit long-term care insurance is expensive, but here's why. One is the claims are $12,000 a month, $140,000 a year, every year,
Right.
as long as you live. Somebody diagnosed with Alzheimer's today can expect to spend about $1.25 million in their lifetime. So number one, the cost of care is very expensive. So the premiums are
Right.
more commensurate. Well, there are now forms of long-term care that are more palatable. At least I can wrap my financial advisor brain around it. The
Okay.
idea of, like I said, $5,000 to $8,000, $10,000 a year, and I may never need it, is like, that's expensive. However, today there are policies that say if you never needed the money, if you didn't live long enough, like maybe you got hit by a bus on the way home from my office, and you didn't live long enough to get into the long-term care, or you were lucky enough to live a long, full life and you die at the age of 97 in the comfort of your own home, and your family looks around and says, well, they had this great policy, they just never needed it. Well, today there are policies that will say if you have so much, $250,000, $300,000 of long-term care benefits,
Okay.
if you never use them, your beneficiaries will get the entire $300,000.
Oh my God.
So
where's
now-
the risk there?
None.
None.
It stays in the family or in the estate under all circumstances. So I liken that as just saying, instead of, you're not really paying money out the door like an expense.
Right.
You're just moving it from this pocket to
To
this
another
pocket.
pocket.
So you have it if you need it, and then if not, it goes back to this pocket.